Healthy Women, as far as innovation in women's healthcare, has really progressed. We used to be a toll-free number and a newsletter. That's how we provided women with health information, but we've evolved in now creating one of the top women's health websites that provides women with information resources that are medically vetted, taking current research and making sure that it's written so that consumers can understand it, and providing all the great resources, links, and tools that women need to make an educated and empowered decision on their health care. I think research is definitely needed to advance women's health care. More research on women, education, and technology is going to be playing a bigger and more important role in making sure women have access to that information.
Innovation in healthcare, for me, it means looking at medicines through the idea of side effects. The breakthrough concept for MedShadow Foundation was that we're all going to be taking drugs at some point in our lives. Drugs save lives. That's a simple fact. But there's almost always a choice between drugs. And the determining factor is not the efficacy of the drug, because many drugs can be helpful in a health situation, but it's the side effects. Which side effects can you tolerate best? We think that should be part of the discussion at the very beginning of the prescription path. The doctor visit is only one visit, maybe two visits during the course of the year, so you need to be prepared for it. What we have as a downloadable, but we also have as a takeaway here at the conference, is a cheat sheet. It is 7 questions that you would ask your doctor to help you guide the conversation when and if your doctor suggests prescription medicine or even an OTC medicine. These are questions you want to have ready so that you've explored all the options and know what you're agreeing to. When women are managing an entire family's health care, you need to be able to look up what the side effects are and the interactions are between various drugs to help keep your family safe and so that you can have intelligent conversations with your family healthcare provider.
Innovation in women's healthcare for me means that we are focused on prevention. And prevention, especially for women, is allowing women to take the time to take care of themselves, because women have a tendency to put everything else before them. So having the time to exercise or just to be active, eating properly, taking the time to eat, and taking the time to de-stress, for me, are the pillars of what a vibrant health is for women. I'm very, very happy that I was invited to the HBA sponsor Healthcare Forum for Women and to share my program with my executive peers here today. What really happened last year is that I pioneered the program. So I had almost 60 women on the program. They lost an average of 12 pounds in 12 weeks, up to a maximum of 30 pounds. And I'm monitoring them now to see how they have really been able to change their behaviors, exercise more, take more time to de-stress. And in that respect, it's been very successful. Now, my next plan is for 2015 to do a clinical trial and to prove that this program is working not only after 12 weeks, but also for with a 1-year follow-up. And then I will publish this and use this with insurance companies to get reimbursed.
Queens Hospital has many programs going on, so we're just going to touch on a couple of them. Our research program is a very extensive program. We have treatment programs in breast, cervical, ovarian, lung, colon cancer, amongst others. And it's very important for our population to be part of the clinical trial initiative. We have 108 different languages spoken at Queens, and just as many ethnic backgrounds and religious backgrounds. So when you're talking about the treatment of tomorrow given today, one of the innovations in the new treatment is that we're trying to target the therapy towards the cancer biology. It's not just chemotherapy anymore. It's really, which targets all rapidly dividing cells. They're literally looking at the cancer cell and trying to target treatment towards what the patient has. And that's something that you need a large amount of ethnic backgrounds to make sure that are represented in these clinical trials to make sure that you are treating the right thing for all patients.
Innovation in healthcare to me means not only is it about healthcare, but more specifically in women's healthcare, it means that we not only include women in those perspectives, but that we also talk to her and her family and her, her partners, her children, because more and more across the country we're spanning cultures and we're spanning generations. And women happen to be the chief medical officers of their homes and their circles. So when we can translate that into not only being relevant to her, but being relevant to her partner, her parents, and her children, that's when we can be truly innovative. So what we've done is created a campaign in Spanish, created by Latinos, in language, that is focusing on type 2 diabetes, because this is a major problem for Hispanics and for the country. My focus for 2015 is on the U.S. Hispanic population, and at Wills we are absolutely showcasing cuidatudon.com, because again, it is something that has not been done before. We're using our cultural insights, talking about food and exercise, and family is included in this campaign because nothing happens in a vacuum. Health isn't an other thing, it's an everyday thing. And when we include those everyday things that people do or don't do, that's when we can start making a difference. So that's why we're highlighting it.
NAREP, the Alliance of Research Associate Programs, research associates are college students interested in the healthcare professions who volunteer 1 4-hour shift a week in the emergency department as data collectors for clinical research. It's a way for them to have discernment. Is this really what they want to do, working with people who are sick? It's their qualification. Are they any good at it, right? Are they able to actually work and have significant interactions with patients in a productive way? And that it's their development, that they start at some point about how they are working with patients, and then with time and with training get better and better. We think this model can be expanded so that if you're a hospital within 30 miles of a college that has people who want to go to health professional school, go to medical school, that you can have research associates at no cost who are tremendous with your patients and can get us valuable data, but can also perform the kinds of primary health care and facilitate the kinds of primary health care that can really make a change in how we do that nationwide.
Our goals for 2015 are to spread words around, not about our product. Our product has app application, education CD inside. It's education, to give access to knowledge, information they never had before, to have device which allow to check saliva daily. Saliva zero costs nothing. You know who you are. It means you know when to have sex, when to have healthy sex, when to conceive baby, or if you can see you are not ovulating a long time, like expedite natural family planning, or take really treatment if you really need it. So also know when it's a 21st century. Know when has an app application which allow you easily to click the button what picture you have. Application will allow you and send you alerts what's going on. You can track your sexual activity. It's just style of life when women have control. So this is, and the most important that we are the only device who really went through clinical studies in the US and with high quality and proven accuracy. So this is very important because this is really not only device, it's information, knowledge together with product. So a woman feels so comfortable and understand her uniqueness. So this is, no one is all about you.
Innovation in women's health care to American Bone Health means staying tall, strong, fracture-free, able to care for kids and grandkids, and to be role models for healthy living. American Bone Health will be doing posture and balance screenings and showing exercises from the Do It Right campaign. I was diagnosed with osteoporosis when I was 28, so I have a very personal interest in this, especially an affinity for organizations like American Bone Health that put out information and knowledge to people with osteoporosis. You see, osteoporosis is an under-recognized and probably underrepresented public health crisis. And it's also 80% represented by women. So in other words, 80% of the people with osteoporosis are women. So we want them to know their risks. We want them to know how to preserve their bone density, how to make good lifestyle choices through exercise and nutrition, and obviously how to prevent fractures.
For nearly 100 years, the American Medical Women's Association has been the progressive voice of organized medicine, addressing the tough issues that affect how medicine is discovered, taught, and practiced. We are women healthcare providers who care about women's health, women's well-being, and women's leadership. AMWA has consistently championed universal access to preventive and primary health care. Innovation to AMWA is viewing science and medicine through an innovative lens, thinking outside of the box and finding creative solutions to the specific healthcare needs of women, embracing new scientific data and helping to translate the findings of research to the treatment of patients, and understanding that changes in healthcare begin with the education of students, physicians in training, and practicing physicians. AMWA will be exhibiting information that addresses the changing needs of women's healthcare through education that combines both traditional approaches as well as embracing new technology to engage and inform students and medical professionals. AMWA has developed an interactive, engaging website to promote the awareness of this issue among healthcare providers and students. And this year we've also launched a preventive medicine services app that serves as a central hub of information flow from trusted sites such as surgeongeneral.gov and womenshealth.gov.
Innovation in healthcare is especially for me about cancer, and trying to bring the new treatments and best treatments for cancer of all kinds to our community, which tends to be the underserved community, to make sure they get state-of-the-art treatments. Well, the focus for Queens Hospital Center is basically early detection. We want to get early detection on all sorts of cancer, including breast cancer, which means mammography, colon cancer, which means colonoscopy, lung cancer, which means anti-smoking programs, and prostate cancer, early detection means getting your PSA and digital prostate exam. So we're trying to make sure that the community knows about these tests and knows that there are ways to get early detection. One of the ways that we're reaching out into the community is the Queens Library Health Link. The Queens Library Health Link is a special program that we started along with Memorial Sloan Kettering and the American Cancer Society approximately 10 years ago, which reaches out into the community via the Queens Library, which is the largest public library system in this country. And we can reach the people in the community so that they can learn about the different programs for early detection and then take advantage of them.